KTVU Fox 2 News at noon starts now.
Well, hospitals can be an uncomfortable place for both adults as well as children, but after the break, we will show you what one Bay Area hospital is doing to call itself an Ouchless emergency department to ease the fears of children. Well, a trip to the hospital emergency room can be emotionally traumatizing, especially for a child. But now, Marin County's largest hospital has found a new approach in dealing with children who find themselves in the ER. As
KTVU's Rob Roth reports, it's being called the Ouchless emergency room.
Hospital emergency rooms are no one's idea of fun, especially for a child. But here at Marin General, doctors and nurses are finding a new way to make the emergency department a less scary place for kids. They even have a name for their program.
We're focused on trying to make the ED experience ouchless. That's why it's called an Ouchless ED.
The Ouchless Emergency Department is set to roll out next week. Some of the exam rooms have murals for children. Doctors and nurses have received training on how best to communicate with a child in distress and perhaps demystify hospital procedures. The young patient may first get a doll like this.
This doll has an IV. So we help the child place the IV so that they actually see what parts is going to be left in their arm, how we put it in.
The plan is to eliminate pain. A spray mist of medication will often replace shots. And when a shot is necessary, the vibrating buzzy bee can serve as a distraction so the child won't notice or feel an injection.
If they have an experience where they feel like they weren't out of control, they weren't threatened, that the experience in the emergency department would be less anxiety-provoking.
Children are not just occasional visitors. Emergency room doctors say they see on average 20 kids per day here. Marin General is the only community hospital that's doing this for children. None of the medical procedures are changing, just the approach.
People weren't necessarily explaining to the child in their language what we were going to do or taking the time to show them what the procedure would be.
And the hospital says the new approach could change how a child views doctors and medicine later in life.
It's not something that you want to associate pain or fear with. You want to be able to associate, a feeling that I get better when I go there.
In Marin County, Rob Roth, KTVU, Fox 2 News.